Hey, my name is Micah Clark, and for my research proposal, I chose the effectiveness of EMDR when treating soldiers with combat PTSD. The reason that I chose this is trauma and PTSD is the area focus of my passion. I really want to work in that area, and I have done a lot of research. The research that I have previously done show basically that CBT, trauma focused CBT, and other treatments were the primary treatments used when combating combat PTSD. And then I heard from one of my professors in undergrad that EMDR is just as effective. And I have done some digging, and it did show that EMDR is effective, but there's a lack of research on how EMDR is compared to other treatments. So I did a lot of digging, and what I found is that I found about 10 or more studies that show that EMDR is just as effective, if not more effective in some cases, than other treatments when treating combat PTSD. So I found that really fascinating. So I based my whole research proposal on how EMDR is effective when treating combat PTSD in soldiers. Um, the research question that is aimed to be asked is how is EMDR effective when treating combat PTSD compared to other treatments? And basically, the literature I found had a few gaps. One of the gaps being that a lot of the studies excluded female participants, so that the research was not transferable to both genders, just males. So I wanted to create this research proposal that included both male and female participants. And the other gap is they didn't do follow up on the effectiveness, which I think is very important. That we need to know the after effects of the treatment, if it has prolonged effects or if it's just short term. So that is what my proposal is aiming to answer. The study design within this proposal is a randomized controlled, and because of that, the null hypothesis of the research proposal is that EMDR therapy has no differential effect from treating combat PTSD. Um, the hypothesis for the study that is going to be answered is if soldiers are administered EMDR therapy, the overall symptoms of combat PTSD will diminish just as effectively as if they were given other treatments. In order to be a participant in this study, uh, they have to be male or female active duty military personnel that have been diagnosed by the DSM 5 with combat PTSD. If they are not in the military, nor do they have diagnosed combat PTSD, they will be excluded. This study will utilize the population of male and female military personnel that are suffering from combat PTSD. They'll be around young to middle-aged active duty soldiers from a wide range of demographics to try to avoid biases so this research can be transferable to every demographic. The instrument used within the study is the Davidson Trauma Scale, which is used to assess the severity of the PTSD through a short questionnaire. Um, what I researched is this was pretty effective in the treatment. This instrument uses the reliability of retest to calculate the results of the participants. The proposed statistical analysis was kind of tricky for me to try to pinpoint, but kind of what I figured out was that the type of data that will be generated from this study will be ordinal data, because it will be measured from no symptom to severe symptoms, and the most appropriate statistical test for producing ordinal data is the non-parametric, because it focuses on the median of the data. The result of the analysis, after being conducted, will evaluate the hypothesis by testing the average treatment effectiveness of all the soldiers. It's really those administered EMDR treatment. So yes, by conducting all this, it will ground in research and kind of introduce to the field that EMDR is a treatment option for people that have combat PTSD. They don't have to be excluded to just CBT, trauma CBT. This opens a whole new other option for people that may be hesitant about doing other treatments. And I think that is going to be a great thing for the counseling field. And I think it'll be very beneficial to push this research into the EMDR treatment, because EMDR is so useful in treating so many different things. And that is what I have done for my research proposal. Thank you guys for listening.